I'm Jenny Cavalier. I'm one of the advanced nurse practitioners at the practice, as well as clinical lead for respiratory. Well, ever since obviously the new guidelines came in, it's going to be a huge help, especially with regard to diagnosis of asthma in adults and children, and allow us to accurately diagnose and manage patients, obviously according to the new guidance. It's going to make diagnosis a lot more easier for adults and children. So, in particularly for patients, it's going to speed up diagnosis because obviously FeNO is a much quicker test to do in clinical practice, and that's the same for staff. To be able to perform the test is a lot easier to do than, for example, other testing that you would do for asthma, such as spirometry, things like that, which takes a lot more longer to do. And obviously, for a practice benefit, it reduces cost and clinical time. Several factors. One is that it's an exhalation only machine, so it takes that other component out, which a lot of patients will struggle with competitor machines. Its cost factor for the flow heads is a lot more practical and more cost effective. And the servicing, it's easier with reservicing. It's cheaper compared to having to change multiple parts of the device, which other machines unfortunately don't have the facility to do so. It's part of the guidance, and it also then gives good clinical care to both your patients and families.